Hi, it's Angie reporting from Tijuana, Mexico, and I've been here at the Holistic Clinic, although right now I'm in my hotel room, for 4 weeks. Tomorrow it'll be 4 full weeks, and I'm going home on Friday. I almost decided to stay one more week, but I decided no, I'm ready to go home. I miss my bed, I miss my blender. I have a little blender here, but I don't have a freezer in my room, so I don't have frozen fruit, and I don't have ice, and I don't have all the conveniences of home. And after a month of this, I'm just ready to go home. I can manage another few days because I know I'm going home. But it's been great here. I've loved so much about it. I love Mexico. I love the weather. The weather's been so much better than it is back where I live in Ontario, Canada. And it was rainy yesterday on a Saturday, but today it was supposed to be cloudy all day, and I see some sunshine out there, and it's nice enough to go outside and get some fresh air and even a little bit of sun. So I might go out there in a little while. This time I'm going to talk about my dental appointment. When I first got here, I paid for a $350 package with Dr. Bergman's office that includes a whole pile of stuff. Really, really worth the money. I'm not going to go through everything right now. I'll talk about that maybe in another video. But one of the things it included was a free dental cleaning and x-rays with the dentist. So I did that the second day I was here. And actually right after I fractured my knee, I didn't know it was fractured yet, and I just hopped in the chair and let them do their thing. It was really cool the way they clean. They don't use those sharp tools and scraping your teeth. One of those vibrating things instead. Like I have one myself. It's obviously nothing like what they have, but it's the same type of thing where it just vibrates when it touches your teeth, and it just makes the stains and plaque and stuff fall away. Now I'm not going to get as done as well myself because I don't know what I'm doing and because my tool is nothing like theirs. But when you go in, get in the chair, they give you protective sunglasses because they're using some kind of infrared as well, and they wear the glasses as well. It must help with their being able to see whatever they're looking for. I don't know. I didn't ask. But when I went for that, I found out I had some cavities I didn't know about before. Anytime I've been to the dentist, I never have let them do x-rays for a very long time. So there's some things that I think they couldn't see without x-rays. But for this time, the worst was my back upper molar already had a filling, my only filling that I've had in my adult life, and it needed to be redone. It's not amalgam, luckily. It was the original one, but it fell out one day, so it was redone, and it wasn't done well because I wouldn't let them give me extra freezing, so they wouldn't remove the casing, so they just refilled it with the old casing, whatever all. But here they do ceramic fillings, and that's what I had done yesterday. And boy, what an experience. Like, I don't want to turn anybody off of the dental here. I've talked to so many dental patients here. Not one of them complained and said, oh, it was awful. Sitting in that chair was so dreadful. None of them. And they were having far more extensive work done than just filling a cavity. They were doing things like having amalgams removed, and they used, I think it's called the Higgins protocol, very, very safe and effective, and they use a vitamin C drip and ozone, and you get chelation IV therapy afterwards to get rid of anything that might have escaped, any metals that might have escaped and got into your body. And none of them complained. People are having root canals removed and having implants done. They use zirconia for implants and ceramic for the fillings. So I had this back one had to be replaced, so it was big, a big thing they had to do a fair bit of prep work on. And the one beside it, I knew I had a cavity beside that one. I was told that a few years ago, and I was trying to heal it myself, but it didn't heal. I think I didn't do enough. I did too little too late. So that had grown quite big. And then the one beside that was just a tiny one. So I decided, there's a couple other small ones, I forget where, but I decided, and they did too, they said it would be best too, probably just start with these three, because that took 3 hours. And I know, I was shocked too. 3 hours for 3 fillings? Are you kidding me? It should only take 20 minutes for a filling or something like that, right? That's all it's ever taken me. But this is why. The little one, like they put needles in just like they do in any dentist to freeze you. Only the first needle hurt, not a ton, but it hurt. But then the other needles didn't because they froze enough from that the other needles I didn't even feel. But then they started drilling and working away, and I was a wimp, like right from the beginning. I told her I was scared. I had childhood trauma with a dentist, and I think that's partly why I'm such a wimp. But anyway, that first one, at one point she said, like near the beginning, she said, I already got one filling finished. The small one is done. So that's easy. It was nothing. It's the big ones that took the time. Okay, there was more and more drilling and prepping and whatever all they were doing. And then they had to take an impression where they bite into this putty looking stuff on the top and the bottom just to get your bite right later. That's why they do the bottom one as well. And I hold that in for a couple minutes, and I pull it out. And when that's finally all done, and it was well over an hour, oh, it was a lot of sitting there. I've never had to sit so long in a dental chair. I've been lucky. I've never had root canals or anything other than a couple fillings. When I was a kid, I had more fillings, but all those baby teeth were gone. And then I've only ever shown up like one cavity all my adult life, so I don't know why I have more now since my diet and everything is better, but I do. So anyway, drilling and doing whatever all they do, and prepping to prep these teeth and taking the impression. So after an hour and a half or so, they sent me away so they could make these fillings in their lab from the impressions they took once they'd had it all prepped. So they said it could take a half an hour or more, depending on how busy the lab was. It took an hour. I got to wait in my hotel room, then they called me and I rushed right back down there to get it over with. By then my freezing was almost gone, but nothing else hurt after that. The hard part was over. But they had these fillings and they would put one in and then take it out and do a little fine tuning to it with I don't know what you call it, some little grinder tool, and then put it in again, it's in and out 2 or 3 times for the very back one. Then it was set. Then the one beside it, I had to take in and out more times until they finally, you could feel them kind of pushing it in. And she said at one point they used a special kind of glue. So they pushed it in and hold it tight, then it was in. But then they work on your bite. You have to bite down, and they put some kind of paper or something in there. You bite, and they look at it and bite on this side, and then they're grinding inside again to get the bite right. Because it was like at first, if I bite down here, then this side was open still. Not that much, but you could feel it was still open. So that took a little bit of fine tuning, quite a few times of doing that. And then when they were done, I said, it doesn't feel right. It feels like when I bite down here, this is still open. And she said, no, you just got to get used to it, and there's still freezing, and your bite is good. You'll be fine. I didn't fully trust her, but I went away and she said I could eat after a half an hour because it had been over 3 hours since I'd been frozen. And I did notice it was good though that it didn't stay frozen all day. Like when I've had freezing done at dentists, like regular dentists where I live, the freezing in my mouth would stay in there all day and it drive me nuts. I couldn't stand that feeling. But this was only half my tongue and up here, and after 3 hours it felt almost gone. But she said, wait another half an hour before you eat. And I cooked up the ground beef thing that I mentioned in another video, ground beef and veggies in my hot pot in my room, and had that. And it was fine. But it was still irritating, and you could feel that where they put the needles in, that spot was still kind of sore. It didn't feel great. But then by last night, it was all better. I feel great now. My bite feels good. They did an excellent job. I don't regret it for an instant. I would do it over and over again, but I'm so glad it's over. I found it traumatizing. I'm not, I don't, I don't want to turn people away from it, but so understand what a wimp I am, and I had childhood trauma, and when she was starting to drill and everything, I had flashbacks of that childhood trauma at the dentist, and it's just me. It's not anybody else. Nobody else that I talked to had this kind of difficulty at that dentist. They had all kinds of extensive work done, and they said, no, it wasn't that bad at all. It wasn't bad. You just let them do their thing, and it was fine. Myself, I was like, oh, let it be over, let it be over, let it be over, let it be done. Oh, it was awful. It was traumatizing for me. But I'm over it now. The next day, and even last night, I felt a lot better once my mouth started to feel more like 100% normal. And it feels really good to bite down on. I'm really glad because I was having like cold sensitivity up there. Like with cold water and that, I would avoid letting it go on this side very much. And she said that should be gone. And if I have any sensitivity now, it's because some of the nerves still have to heal because a couple of them were deep. So when I come back October, November, I'll have a couple, I think they're down here, a couple of the small ones done, but it'll be no big deal because they're small and it'll just be a quick filling and a lot cheaper. It was kind of expensive to have those deeper ones done, but it'd be a lot cheaper just to have the quick ones done, like the one closer to the third one from the back. It was such a small one, I couldn't believe it. She said, I already finished one. And I'm thinking, why does it take 3 hours to do the others? Well, because. So I'm going to work with hydroxyapatite and everything. And some people put diatomaceous earth in their teeth. Like they kind of pack it in and then sleep that way. And then wake up the next day and rinse it out. And some people have healed cavities like that. So I'm going to try doing some healing between now and November. And if there's some still not healed, I'll let them fill them before they get big. Because it'll be a lot cheaper, a lot easier, and a lot less traumatizing. But again, don't think it's going to be traumatizing for you. Nothing hurt. Not even a little bit, except that first needle hurt a little bit. Nothing after that hurt. I just don't like it. Having a dentist dig around in my mouth is like one of my worst nightmares. I just don't like it. Although, I have to say it was easier. I told her halfway through, like, thank you, you guys are great at this because it's so much better than being at a regular dentist. She told me that at the beginning. I told her I was scared. I was pretty much in tears. And she said, we can give you drops and to help the anxiety. And I said, will that make me sleepy or put me to sleep? She goes, oh, it'll make you sleepy. And I said, no, I don't want that. I don't want it because, I mean, I'm already hobbling around with a cane and because of my knee and everything. So I don't want have that, so I just let them do it. And I said, well, I imagine children do this without having the drops, right? It's just, yeah, most of them are fine with just what you have, just with the freezing. So I let them do it, and it wasn't the worst thing in the world, but for me, I wouldn't want to have to do it again. But if I had a deep cavity, I would. But I'm going to definitely take care of these other ones before they get that way. Because I think you could be in and out of there in 20 minutes if you just have a filling, just like any other regular thing. But I've never heard of these types of fillings where they actually make them in the lab and place them in. It's like they're making implants almost, but it's just to fill up your tooth. So very interesting. If you've had any such thing with a holistic dentist, let me know and how it was for you. And if you want to try the holistic dentist care in Tijuana, Mexico, use my code when you go there, Angie Health, and you'll get a free dental cleaning. And that's a cool thing. Like, I didn't mind them cleaning. I didn't get traumatized from that. It was a lot better than having to have cleaning at a regular dentist. And so was this for fillings, even though it took that long. I've just never had to sit that long in a dental chair. But they took good care of me. Every couple minutes they'd say, close your mouth, and they'd put that suction thing and suck out all the spit and everything, whatever's in there. And they spray your mouth sometimes with water and let you and suction that out. And they kept putting this stuff on my lips. And I said, what's that? And she said, to keep your lips from getting dry. I never felt them getting dry, but she kept putting it on several times throughout the treatment. So that's what to expect with fillings. I did an interview with one of the doctors at the clinic about the other things that they do. So I'll try to post that today too. I can post that. And he gives more information about the other dental services that they provide that I thankfully don't need. Okay, thanks for watching.